Bismillahirrahmanirrahim and Assalamu alaikum. I am Professor Dr. Gilani, working as Chairman of Afro-Asian Institute of Medical Sciences and Founder Dean of Faculty of Allied Sciences at University of Lahore in Pakistan. There are some students who have finished with their A-level or with FSE pre-medical, and few of them are not yet eligible to get admission due to their lower marks in MCAT in Pakistan or due to higher merit, they failed to get a seat in any of the medical colleges in Pakistan for MBBS or for BDS. Most of them are depressed for selection of their career or for profession. I have a series of discussions. I will be discussing the main degrees which are being offered in Pakistan for such students, which are better choices for them instead of repeating their MCAT or FSE exams. So let's discuss why I take admission in DPT, which is the Doctor of Physical Therapy. First is, what is physiotherapy? A healthcare profession concerned with human function and movement and maximizing physical potential. It is concerned with the human body function and its movement so that the physical potential of the body is maximum. It is concerned with identifying and maximizing quality of life and movement potential within the spheres of promotion, prevention, treatment, intervention, rehabilitation. It is used for through different approaches to promote, maintain, and restore physical, psychological, and social well-being, taking into account variations in health status. So physiotherapy is science-based, committed to extending, applying, evaluating, and reviewing the evidence that underpins and informs its practice and delivery. The exercise of clinical judgment and informed interpretation is at its core. So the physiotherapists have to judge the problems clinically and advise the exercises, which is the main core responsibility of the physiotherapist. In a nutshell, it is a science-based healthcare profession that looks in detail at how the body moves, how muscles, bones, joints, and ligaments work, and how they react to pain and trauma. The next question usually asked is, who are physiotherapists? So, dear students and colleagues, the physiotherapists and physical therapists work within a wide variety of health settings to improve a broad range of physical problems associated with different systems of the body. In particular, they treat neuromuscular pain, neuromuscular disorders, which includes the brain and nervous system, musculoskeletal system, like soft tissues, joints, and bones, cardiovascular and respiratory systems, including heart, lungs, and associated physiology and pathologies. Physiotherapists, they work autonomously often as a member of a team with other health or social care professionals. Like in orthopedic department, they can work with the orthopedic surgeons and their technologists. Working in the community, they can work with the physicians, the GPs, the general physicians. Physiotherapy practice is characterized by reflective behavior and systematic clinical reasoning, both contributing to and underpinning a problem solving approach to patient centric care. So, the main aim is to solve the problem of the patient. What does a physiotherapist do? They regain mobility after accidents or surgery. So, if the patient has got accident or had surgery, after that, a patient will be in need of a physiotherapist so that that patient can come back to the normal life, a healthy life. Then they help in avoiding injuries and create healthy lifestyle plans, which is called preventive healthcare, by their consultation, lectures, and by different digital resources. They treat specific conditions like spinal problems, backache, joint pains, etc. Patient access to physiotherapist. People are often referred to physiotherapy department by doctors or other health and social care professionals. Increasingly, as a result of changes in healthcare, people are referring themselves directly to physiotherapists, which is called first line assess that the patient himself or herself is self-referred or going directly to the physiotherapist because of the awareness by social media, that is even without previously seeing any other healthcare professional. Trends in Canada and Australia, for example, are even exploring the role of the physiotherapist within the triage system of emergency departments. Let's discuss the history of physiotherapy. The earliest documented origin of actual physiotherapy as a professional group date back to Per Henrik Ling, father of Swedish gymnastics, who founded the Royal Central Institute of Gymnastics in 1813 for massage, manipulation, and exercise. In 1887, physiotherapy were given official registration by Swedish National Board of Health and Welfare. In 1894, four nurses in Great Britain formed the Chartered Society of Physiotherapy. The School of Physiotherapy in the University of Otago in New Zealand in 1913 and in United States in 1914, Reed College in Portland, Oregon. In March 1921, Mary Macmillan organized the Physical Therapy Association, now called the American Physical Therapy Association, APTA. Treatment through the 1940s primarily consisted of exercise, massage, and traction. Manipulation procedures to the spine and extremity joint began to the practice, especially in the British Commonwealth countries in the early 1950s. Later that decade, physiotherapists started to move beyond hospital-based practice to outpatient orthopedic clinics, public schools, colleges, universities, geriatric settings. that is the old people houses, rehabilitation centers, hospitals, and medical centers. The specialization for physical therapists in the US occurred in 1974, where the orthopedic section of the APTA began formed for those physical therapists specializing in orthopedics. Let's see what is the history of physiotherapy in Pakistan. The School of Physiotherapy was established in 1956 by the Federal Government Ministry of Health and Social Welfare with the assistance of World Health Organization in Jinnah Postgraduate Medical Center premises. Initially, the school offered a 2-year diploma course with the minimum entrance qualification of matriculation science group. In 1961, the 2-year program was upgraded to a 3-year diploma. Later on, the program was raised to BSc Physiotherapy degree 3 years in 1963, and the eligibility was FSc 12 years of education affiliated with the University of Karachi, and pertinent changes were added and made in the syllabus according to the need. The international faculties of physiotherapy had upgraded their syllabi. In order to match those standards, in 1999, BSc Physiotherapy course was upgraded to 4 years BS Physiotherapy course, which was based on eligibility of FSc pre-medical, then having 4 years of teaching and training in the universities. Recently, following the VN 2020 of APTA, the 4-year BSPT program was upgraded to 5 years DPT, which is Doctor of Physical Therapy program in 2008 to meet the international standards. Degrees offered in physiotherapy are Bachelor of Science in Physical Therapy, which is BSPT. The requirement was FSc pre-medical, Doctor of Physical Therapy, which is DPT, Transitional Doctor of Physical Therapy, which is TDPT, Master of Science in Physical Therapy, which is MSPT or MPhil PT. And then the University of Lahore first ever offered the Doctor of Philosophy in Physical Therapy, which is a landmark for that university. It is PhD in Physical Therapy. Till today, 5 scholars of PhD have graduated, that are the first ever 5 PhD holders from any university in Pakistan. We have some PhD graduates from Iran, Sweden, and some other countries. The clinical specialties for physical therapists include the musculoskeletal and ortho departments or systems, the cardiopulmonary, neurology, pediatrics, sports medicine, rheumatology, older people that are the geriatrics, pain, women health, oncology, extended scope, and public health, etc., are the main clinical specialties. Where do physiotherapists work? They work in women health, palliative care, intensive care, learning disabilities, outpatients, pediatrics. They work with the orthopedic department, in the mental health, occupational health is very vast subject which is being dealt by the physiotherapist excellently. They are the professionals. They deal with the stroke rehabilitation wards and they care for the elderly. Other exciting areas for physiotherapists are armed forces, where they serve the soldiers, then sports clubs, sports teams. Nowadays, all the sports teams The national teams have got their official physiotherapists who are highly paid. Then are the private clinics and hospitals and research centers. Physiotherapists, they can work in outpatient departments for back, neck, and joint problems, sports injuries. Neurology, they encouraging mobility in those after stroke and Parkinsonism. In orthopedics, after hip knee replacement, RTAs. Cardiovascular, for exercise rehabilitation. Respiratory, chest clearance, exercise rehabilitation. Remember, in the period of COVID, there was a role of physicians, respiratory therapists, and physiotherapists to bring the sick people who suffered from COVID 19 to come back to their normal life. So we salute the team of physicians, pulmonologists, respiratory therapists, and physiotherapists who brought our Pakistani patients back to their normal life. Even worldwide, such teams, they serve the humanity in excellent and professional way. They work in pediatrics for cerebral palsy and for spina bifida. There are some more indications in pediatrics which I have not discussed here. Women health, advising on antenatal and postnatal care, including posture and exercise. In occupational health, working in companies working on how to prevent physical problems and injuries. Sport clinics and teams helping recovery from injury and return to full fitness for the players. And in community care, they're treating the patients at their homes, especially for the bedridden patients. Career in physiotherapy, if we look at this data, that physiotherapy is the seventh most earning profession in the world. Physiotherapists are granted 17th grade to start in government and private sectors with many chances to excel due to few graduates in Pakistan. Physiotherapists can work in the field and academics. Physiotherapists can look to be specialist in more than 20 specialties. Internationally granted jobs in clinical and research centers. Majority work in USA, UK, Australia, and many other countries abroad, like in Gulf. In 2008, physiotherapy was fifth most earning profession in USA with 67,000 per annum US dollars. Latest reports in 2011 revealed the salary of USA as the physical therapist 58,000 to 73,000 plus per annum, and physical therapy assistant who is having matriculation with 2 years diploma in physiotherapy, and in some countries it is FSE based, having 2 years ADP degree, associate degree, which they earn from 38,000 plus to 60,000 plus per annum. The physiotherapists can work as consultants, as administrators in a hospital or a clinical setup. They can work as client manager and as educators. The average monthly salary in Pakistan, professors they get 300,000 plus, associate professors 250,000 plus, assistant professors they get 100,000 plus, the lecturer they start with 60,000 per month, and the clinical physiotherapists who are the demonstrators or they are the beginners they start with 40 to 45,000 rupees per month. There are immigration opportunities for physiotherapists. There are some licensing exams. Some of the universities are or some centers are preparing the people for that exams. Once they pass that exam, they can have immigration very quick, fast track immigration to USA, Canada, Australia, UK, Europe, and New Zealand. So the students are advised not to be depressed that they did not get admission in MBBS or BDS. Be ready, be a physiotherapist, and serve the nation. Special thanks for collecting data for this discussion to Associate Professor Dr. Sayyid Asadullah Salar, who is head of Department of University Institute of Physical Therapy, the University of Lahore, Pakistan. Thank you very much.